It has felt a little bit like a promise that had to be dragged out of the government when it should perhaps have been in place anyway. But finally, the thousands of people who live and work in care homes were told they will now get tests for the coronavirus if they get symptoms. The big question is how long it will take to test everyone who needs to be checked. The Health Secretary, Matt Hancock, also made a commitment that those discharged from hospital to a care home will be tested before they leave. The question for many, is it just too little, too late?
There is a bow for every life lost here. A colourful memorial of ribbons for 10 care home residents who've died in the last 2 weeks. Not all had been tested for this new deadly virus, but so many deaths in so short a time is like nothing before.
It's horrific for staff. I served in Iraq with the forces, and actually said to one of our local GPs that I'd actually rather be back in Iraq than I would be dealing with this right now.
Staff at St Celia's nursing home in Scarborough held up messages from residents. But one message they really want heard is that this disease is ripping through their care homes and going unchecked. The government pledge to test residents and staff with symptoms then is very welcome.
Testing needs to come soon. Reassurance is what we need. It should have come earlier, but thankfully I understand we're getting it now. I would just make a point. I think the Secretary of State said he was going to be testing patients before they were discharged from hospital. That's all well and good, but we need the test and the result back, and that's the key bit, and the result back before they're admitted.
That is something the government says it will now do to help curb the spread of this disease in care homes.
We will now ensure that everybody who has symptoms gets tested. And the critical other change is that those leaving hospital will now be tested and they will be put into isolation until those test results come through. And if the test results come through positive, then they'll be held in isolation to make sure that they protect those currently in the care home.
And in a rare personal moment, he claimed the death of a 13-year-old boy alone in hospital prompted his next policy change for residential homes.
As a father of a 13-year-old myself, the reports of Ishmael dying aged 13 without a parent at his bedside made me weep. We're introducing new procedures so we can limit the risk of infection while wherever possible giving people's closest loved ones the chance to say goodbye.
The grim effect the disease is having was revealed in Scotland today. A quarter of all COVID-19 deaths were recorded in care homes. 16 have died at this Prestwick facility in just 11 days. Graham McLean had been in his nursing home for 4 years. He's thought to have died from the virus, but his family will never know for sure.
These people that are in the care homes, they are family members. They're the same as you and me being outside, but they're in there and they deserve the same treatment. They need to be tested.
Scotland will now also test its care home residents. For many, the sector has for too long been left to cope alone. Tonight, they will be wondering if this has simply come too late. Emily Morgan, News at 10.
Well, it doesn't get any easier every day to see all this, but Robert is here to talk about the shape of the crisis. He's in the Peston programme studios, you can probably see. Look, Robert, terrible tragedies day after day after day. I think what a lot of people want to know is where we are in this crisis. What's your own assessment?
Well, if you look at the data that's published by the government, you would say that both in terms of the so-called leading indicators, that's new infections and admissions to hospital, but also in terms of the indicator that changes last, which is, you know, the most appalling issue, which is deaths, everything appears to be stabilising, and it does seem to me that those measures imposed on us to massively restrict our basic liberties, our basic freedom to see who we want, they are working. The curve of infection has been pushed down, and the rate at which we are getting this awful illness is dropping really quite dramatically. The thing, though, that I was struck by, I mean, I asked at the press conference today Matt Hancock and the Chief Medical Officer, Chris Whitty, whether we were past the peak. And despite the fact that I think there is growing evidence that we are either at or past the peak, they were deeply, deeply reluctant to say that. And I've been talking to their colleagues about why they're so reluctant, and I think it is broadly because the rate of deaths, although it's stable, is still very, very, very high, and plainly they want to see that that is under control. And, you know, although I don't think that they are motivated by the sort of PR of it, you know, not being the worst in Europe, they plainly are deeply worried that it may turn out that the deaths here in the UK will be the worst in Europe, and they want to do absolutely everything they can to prevent that.
Well, look, we expect the lockdown to be extended, I think, for another 3 weeks tomorrow. What's your sense of the shape? I mean, a lot of people are worried about their jobs, worried about the economy. What's your sense of what we'll get tomorrow? And perhaps more importantly, what the shape looks like beyond that, even for the next 3 to 5 months?
So we already know, because the Foreign Secretary who's deputising for the Prime Minister has already said that the lockdown will continue. I have already recorded an interview for my show, which is, as you said, on in a few minutes, with the Health Secretary, Matt Hancock, and I pressed him on whether after the meeting of the Cabinet tomorrow, after the meeting of the committee called COBRA, which takes decisions in emergencies, whether we would hear how long this lockdown will continue for, and he hinted we would at least get some kind of timetable. But whenever I press people like him about whether we will get any detail on how that lockdown will be eased, you know, for example, there are thoughts that perhaps schools could go back first before other changes like our ability to shop more normally could happen. But no ministers are prepared to be pressed on that at all. I'd be slightly amazed if we did get any of that detail, partly because the chief, as I say, medical officer, again, as I say, I spoke to earlier on today, kept insisting that actually the judgments that you have to make about how you protect the economy, how you protect lives, he says, are immensely difficult judgments. And he basically said, we just don't have all the information yet to make those judgments. Meanwhile, of course, millions of people sitting at home are just deeply anxious about when and whether their lives are going to get back to normal. I mean, just to, you know, finish off with one thing, a minister in Matt Hancock's department, Nadine Dorries, warned us all tonight in a tweet that we are going to be living with some form of lockdown till we get a vaccine, and that means most people think that at least a year.
OK, Robert, thank you very much indeed.